Nada de vomitar,
Good.
nada de estarse arqueando, moviendo, tratando de
No
llorar,
arching
nada de
his
eso.
back, no moving.
What about the button? You know, is that staying clean for
¿Cómo
you?
está el botón? ¿Si ha estado limpio?
Lo he limpiado cada vez.
LAMP has been around since 1997. We specialize in medical interpreting. If we have an emergency room call come in, so the ER representative would call and they would request whatever language they need. So for example, if it's Bosnian, we would forward the call to the Bosnian team leader, and he would look at our schedule and see who we may have available first to cover that call. It's very important for the healthcare providers to use professionally trained interpreters who are going to be neutral, who are going to be unbiased, and who have had trainings, hours and hours of training.
So basically, if you would not have a medical interpreter, medically professionally trained interpreter, the doctor would just assume that something is happening to the patient. I mean, patient would not be able to say, hey, I have pain here, I have pain there. They would just point out at things, but would not be able to verbalize that.
The interpreters help us tremendously because the interpreters that we use through LAMP have been trained not only to interpret, but they also have medical training in the background so that they understand the diagnosis, the disease process, the physiology and the anatomy of some of these diseases, so it helps them to be better interpreters.
As an interpreter, I am trained in everything that is with the medical field. There's a lot of vocabulary that goes along with that, and if you are not trained and if you do not know this vocabulary, you could be telling the patient something completely wrong. So it is very important that they do use an interpreter as opposed to an aunt, a cousin, a neighbor, or somebody who's not necessarily trained. Even though they might know both languages, it is very difficult. Even I sometimes have to stop and think of the proper word or the proper way to say something to a patient in order to be as delicate as the doctor is being with them.
It's important for good medical care to be able to understand what the patient has. We need to understand what the complaints are. If we can't have this information, I don't think we can make a good diagnosis.
Estamos tratando acerca de algo muy importante, que es la salud de mis hijos. Entonces es, creo yo, lo más importante.
We're talking about something so important as it is my children's health. So I think it's something very important.
Así que tener un intérprete a la mano,
So to have an interpreter at hand,
me da el apoyo y la confianza de que todo va a estar bien.
the support and the confidence to know that everything will be fine.